Hello everyone, I am Dr. Shweta Jain from iMantra Hospital and today I am going to tell you about red eyes. Have you ever thought about how your eyes get red? Having red eyes can be a serious concern, especially when you are out to meet someone important or you have to go for an interview or attend a party for that matter. All those preparations brewing in your mind to look good will go in vain. Reason being your bloodshot eyes. Apart from this, red eyes can also be a cause of underlying serious eye health issues. So let's not neglect it and rather find ways to get rid of it. So what is red eyes? Red eyes are sometimes called bloodshot eyes. The appearance of red eyes is caused by dilation of tiny blood vessels located between the white surface of your eye and the overlying clear conjunctiva. These tiny blood vessels, many of which normally are not visible, can become swollen because of environmental or lifestyle related reasons or because of specific eye problems. Now, why does it happen? What causes your eyes to suffer this pain and discomfort? It is usually due to several factors. Let's discuss them. First, inflamed eyes. The conjunctival infection is responsible for causing irritation and swelling in the eye, which in turn leads to inflammation. The inflamed eye makes the white part of the eye turns red. Allergen. Some people face redness in their eyes after coming in contact with the pollen grains present in the air. The presence of mold also causes red eye and is a common allergen. Some are allergic to pet dander, which can also cause redness in the eye. Third, irritants. There are usually those unwanted particles present in the air which comes in contact with the surface of eye and causes red eyes. The irritants present in surrounding like dry air, cough, dust, cold and bacteria causes the blood vessel to swell. Dry eyes. Dry eyes are caused due to the lack of lubrication in the eyes. Insufficient production of tear leads to irritation in the eyes. Dry eyes can also be related to environmental and other factors. Wearing contact lenses, seasonal allergies, and eye strain can also cause red eyes and then turn them red. Some serious causes for which your eyes might get affected are eye infection. The infection in the eye can also cause redness. It can lead to irritation in the eye and also cause pain and change in vision. Conjunctivitis. It is a serious condition in which the redness of the eye is caused due to bacterial or viral infection in the eye. But there is nothing to worry about. The eye turns back into normal in a day or two. Consultation with the doctor is required if redness remains for a long time. A corneal ulcer. Corneal ulcer occurs because of infection, fewer tears in the cornea, burns, extended use of contact lenses, dry eyes or ocular herpes. The wound can be extremely painful with white or grey spots on the cornea, red eyes, swollen eyelids, excessive watering of the eye, and blurred vision. Treatment of corneal ulcer and disease depends on the cause. Ocular herpes. Transmitted through close contact with the infected person. In a few rare cases, ocular herpes can affect deep layers of an infected person's eye and his or her vision. The infection might be transferred to the eye by touching an active lesion, a cold sore or a blister, and then touching your eye. One of the symptoms is redness in the eye. Lastly, uveitis. Uvea is a pigmented portion of the eye and its inflammation can make your eyes red. It can lead to pain and redness near the iris. Let's come to the treatment of red eyes. I usually see people neglecting their red eye problem only to regret later, because it gets even worse with passing days. And then people need to run to the hospital to get this problem fixed. I am stressing upon the need of early treatment because red eyes can be easily cured with the right treatment at the right time. You can either go for the medication or home remedies to get this problem fixed. You can choose from various medications available including eye lubricant drops and antibiotics. Let's discuss them in detail. General drops. They help treat red eyes. In case there is redness or mild allergy in the eye which is causing the redness, then the doctor might suggest using the drops to treat infection in the eyes. But don't forget to consult your doctor before using any of such medications. Your doctor might suggest you Nefem Plus or Mezol eye drops. Your eyes appear red because of those enlarged blood vessels in your eye. And these eye drops have the ingredients called tetrahydrozoline and nefazoline that cause those blood vessels to constrict. Secondly, lubricating eye drops. These are super comfortable eye drops to soothe your eyes, moisturize it, clean it, and can be even used without consulting the doctor. Many of them can be used even if your contact lenses are on. Antibiotic drops. Antibiotic helps to counter infection when you are suffering from it. Anti-inflammatory drops. These can be required in case there is ongoing inflammation of a part of eye causing redness, or if there is an allergy which is leading to redness. They can be mild, which can be used regularly, or can be strong ones if the mild one doesn't help. Besides this, you can also try some home remedies such as warm compresses. Soaking the towel in warm water and keeping it on the eyelid can help ease the irritation and red eyes. You need to keep the towel soaked in warm water and then keep it over the eyelid for at least 10 minutes and then repeat on the other eye. Keeping a warm environment around your eyes helps increase the blood flow of the vessels present in the eyes by heat radiating from the warm towel. It also helps in stimulating the release of oils from the glands present in the eyelid. Cold compress. Opposite to the warm compress method is the cold water treatment or the cool compress. Here, cold water is used. Extreme cold water should be avoided because it may increase the redness of the eye. A cold compress helps to reduce the itching and irritation in the eyes. A fresh and sanitized towel should be used for both cold and warm compresses. You can also use slices of cold cucumber and place it on your eyes. You can also use green tea bags. Take 2 green tea bags, put them in hot water, cool them down in the refrigerator and place them on your eyes. Same can be done with cotton pads dipped in the rose water. You can try this for twice or thrice a day for 15 to 20 minutes. Besides this, you also need to be extra careful with your eating habits till the time you are completely relieved of this pain. So, incorporate healthy eating habits. It can also have a positive effect on red eyes and can cure them naturally. Staying dehydrated can cause irritation and bloodshot eyes, which can be prevented by drinking an ample amount of water to maintain the body fluids. Consume unprocessed food. Processed food should not be consumed in excess as they cause inflammation in the eye. To reduce the effect of processed food, maintain a proper and healthy diet by introducing more anti-inflammatory foods. Consume food rich in omega-3. They should be consumed by the person having red eyes. Omega-3 helps them to reduce inflammation in the eye. Above all, avoid polluted places. As I mentioned a few minutes ago, places with high amount of pollen, smoke and dry air should be avoided by the person having red eyes due to allergens. Even if you are stepping out, use eyeglasses instead of contact lenses for some time. Dirty and unhygienic contact lenses can irritate even more. And even after your eyes are healed completely, it is important to maintain proper hygienic condition for contact lenses if used regularly. If the symptoms still appears after few days of home treatment, it is advised to visit an ophthalmologist for better advice, or if there are other symptoms along with redness like pain, discharge and slight vision loss, then a visit to a doctor is recommended. If you like this video, then please hit the subscribe button and let us know your views in the comment section below. Thank you.